Ready. We're live now? Okay, well, 5:30. Welcome, everyone. Scott Malaney here for another version of our Facebook Live. To my left, Mayor Christina Muryn was kind enough to agree to spend some time with us tonight. As always, our goals are about the same. We want to try and provide you useful information. We want to try and answer questions that you have. And maybe along the way, have a little bit of fun too. Dr. Bill Kose is also here. Dr. Kose will sit in the last half hour. So if you have questions for him, please, you can start typing or texting anytime. Same for the mayor. I'm going to turn it over to her. And after she's done sharing some thoughts with you, we will get to your questions. So, Mayor?
Wonderful. Well, thank you so much for having me, Scott, and Blanchard Valley Health System team. Certainly, it's my pleasure to be here and take this opportunity to address some of the questions that we've received from citizens regarding the COVID pandemic and our continued efforts in Finley, Hancock County to address it. So, first of all, thank you for your efforts in helping flattening the curve and helping prevent the spread of the coronavirus. We've been very fortunate locally that we've kept our numbers so long, and that is truly because of all of the measures that you have implemented and taken seriously, and it's really important that we continue to do that. As I'm sure we're going to reiterate and hear over the next couple of days, months, weeks, we have to continue to take it seriously and make sure that we don't get lackadaisical in how we approach it as a community. And we have to approach it as a team because we all are in this together. So we're fortunate not only that we've kept our numbers low, but that we were prepared, and we're going to address on how we were doing that leading into this. I know some folks have reached out and asked, how is the city performing? We continue to be fortunate that we're kind of business as usual. We have to make sure your streets are repaired and you have good drinking water and everything is moving forward. We have seen a little bit of dip in the income tax revenue as we expected, but all in all, we're continuing to stand strong. And so we're going to continue just to move forward and work and adjust and roll with the punches and the regulations as we get them at the same time that you guys do from the governor's office. And I know that it's been a challenging time, but I would encourage everyone to stay positive and keep reaching out to families and friends and being creative with how we approach this and move forward as we reopen. So excited to be here and answer some of the questions that folks have.
Great. I got one for you just based on what you said. I'm curious. Yeah. On a daily basis, do you get very many calls at your office or at the city office around COVID? Are people finding you a source or coming to you as a source for information?
So most of the questions we are getting, I would say we probably get 10 to 15 questions a day, but it's primarily related to implementing the guidelines that we're receiving from the governor's office. And, folks, especially during the summertime, want to have events and gatherings. And with some of the protests, people have wanted to do, different benefit events. And we've working through how those guidelines need to be shaped. And with sports reopening, all of our recreation facilities, how are we organizing and managing tournaments and different things like that. So we are still getting a number of questions. Luckily, they don't call asking about, testing and some of those things, because we certainly push them to the resource line and Blanchard Valley and Hancock Public Health. But we do get a number of questions still.
Well, it makes sense. You get a lot when you start thinking about swimming pools and outdoor baseball, softball, all that stuff.
Yeah, so we especially when everything was kind of ramping down, we were reading the guidelines that were coming out daily and trying to figure out how to implement that, and then certainly trying to figure out how to help people reopen.
The first question we have here is a woman named Jocelyn. It occurs to me before I read it, though, that I know we talk about the Finley formula a lot, and I've kidded Tim Miley more than once. So could you write that formula down on the board for me? But one of it, I think we've seen with this COVID,
definitely.
Dr. Kose has been extremely involved. The city's been involved. Public health has been involved. All kinds of local agencies trying to figure out what's the best thing for us all to do, what's the safest thing to do, how do we get the resources to the right place. It's been very cooperative.
Right, it has. And you know what? I want to give a big shout out to Hancock Public Health, because they have done a great job in making sure that as we were closing and as we were reopening, we were trying to be as vigilant as possible, but also applying the rules with common sense. And, our approach has been, we don't want to get people in trouble. We want to help you. So as we've been, reopening, and restaurants and businesses have been reaching out to see how they could implement the guidelines and the requirements, Hancock Public Health has been working very closely with them to make sure, listen, here's what you need to be doing to keep your employees and your customers safe. And that's, what we want to do. We're not trying to make it super burdensome.
Yeah. Okay. Well, Jocelyn's question was, what measures are in place to educate the community that the risk of COVID is still just as bad as it was during the stay at home order? And I guess quickly, I would say you just got a pretty substantial answer there. The city, the public health department, Blanchard Valley, and others have been trying our best to keep the news coming forth, the message coming forth that the virus hasn't changed. Our behavior is what allowed us to have the good performance, the low incidence of COVID patients, and we need to be vigilant and keep doing that.
Right. And, to add to that, I think it's important to remember that when we started doing all the kind of closure methods, that was not because we thought it was going to make it go away. It was to make sure that the healthcare system and our different organizations were able to get the PPE and resources, and that we didn't flood it. So we wanted to flatten that curve. We wanted to lower the incidence to get prepared, and then knowing that we weren't going to be able to stay closed for forever. But once we got to a point where it could be contained and then managed appropriately, that's when we were going to start reopening. So that's what we've been doing. And I know we all got very anxious when it was closed because we're not used to that. But we have to do it in a measured way to reopen so that we don't see then a huge spike and make everything that we did, kind of disappear.
Yep. So Jocelyn, thank you for your question. Becky from Finley is asking, are local leaders helping the school district determine solid measures to make sure returning students are safe, especially students with immunity issues?
Yeah. So certainly we are in conversations on a regular basis with the school administration as well as the school board. And right now we don't have what the specific requirements to reopen are going to look like from the state level or even, the CDC recommendations. And so over the next couple of weeks, we will certainly be working with them. That falls under their jurisdiction to make the determination on how they need to operate. But we'll be working very closely because obviously we don't want to send kids back to school and then have an outbreak. That would be a big issue. So we're going to be working closely to make sure that everyone feels safe being able to go back to school in the fall.
And I would say, as a part of that question, some of that, as the mayor said, we'll be able to have a hand in. There's going to be a lot of regulations promulgated at the state level and possibly even the national level. So in some ways, we'll be trying to implement some guidelines or regulations that have been given to us.
Exactly.
Yeah. So thank you for that question. Deb from Finley asks, have we seen an increase in positive cases in Hancock County since the state has begun opening up? Do you see the numbers continuing to spike? Here's what I'd say about that. And it goes back to what the mayor just said. We never did see a spike here. Our incidence has been low and slow, if you will. We haven't had that many cases identified in our county at all. And I don't know, Bill Kose is sitting here. Do you remember the total number so far, Bill?
I think,
is it like 80?
Yeah, I think overall in the big community of what's going on.
Yeah.
In Hancock County, it's about 50. I think
Yeah.
41 or confirmed, and then I think there was like
Our
10
service
probable.
areas around 80.
Yeah. Okay. So we've identified some from people just outside our county. And then in the hospital, I don't know what the total number is, but 2 or 3 has probably been the highest we've had. Yesterday we had 2. So I'm going to go back to what Mayor said. Vigilance has seemingly provided the kind of results we want to see. Now, will opening of restaurants, will opening of movie theaters, when that happens, will those kind of things change the numbers? I don't know, but so far, I like my little phrase of low and slow. We've been able to produce pretty positive results.
Yeah. And the other thing to remember is that it does have that, 14-day incubation period. So we may not see folks start showing symptoms for a while. So it's, 14 days from when we really started kind of opening things up. We're really still in that time frame.
We are, and I would comment, some of the hotspots around the country are tracking the reason for the hotspots back to Memorial Day. I think there was a prediction that it would be interesting to see what happened coming out of Memorial Day, and in some states, bars being open and beaches being open. And I think there's some evidence that some of the new cases we've seen are a direct result of that. So Lori from North Baltimore asks, how are we helping the homeless population in Hancock County? Mayor?
Yeah, so Lori, that's a great question, because certainly our most vulnerable population continues to be the most vulnerable for this virus as well. So early on in our planning, we reached out to all of our kind of homeless services. And we're very fortunate here that typically as soon as someone is identified as not currently having shelter, we're able to get them housed in one of our agencies. So I'll talk specifically about the city mission because they're kind of our most prominent. We worked with them very closely to have a number of protocols in place. One, to make sure that folks staying at the city mission were staying healthy. And if they did begin to have an outbreak or identify someone with a positive case, what did it look like to isolate them so it didn't spread through the mission? So we partnered with the University of Finley and some other entities in town to have plans where we could separate people pretty quickly, kind of self-quarantine, and then be able to get them the resources such as food, medication, et cetera, while they were in that enclosure. And so we have that protocol also for some of our other Open Arms, Hope House, some of those agencies. So they each have a different protocol. But again, going back to, we've really worked well as a community through all of our nonprofit agencies, the health system, and our government agencies to make sure we had clear plans in place and supporting all the more vulnerable population in our community.
So thank you for that question. It really was a great question. I agree with you. Another one for the mayor here. Rachel from Finley is asking, excuse me, why are local restaurants and other establishments not being penalized when their staff members aren't wearing masks? When are there going to be consequences for that kind of behavior?
Yeah, so certainly, we've tried to approach it as soon as we receive a complaint, and I would recommend that those go to Hancock Public Health, and I believe the email is environmental@hancockhealth.org. So you can reach out to them and notify us if you have a concern about a specific business. We are reaching out to them typically within 24 to 48 hours and making sure they understand the protocols that they're supposed to be following. And if they're not following them, understanding why. So specifically with employees that are not wearing masks, I've gone into a number of places where I just told them, and it's very uncomfortable, I'm saying, I'm so sorry, but you really need to be wearing a mask. It is currently the requirement for you. A number of them have said that they have doctor's notes to be able to excuse them. So I would just bring it up and ask. And the businesses that do have that currently in place are not being penalized. At this point, we haven't fined anybody, but certainly if we have individuals or businesses continuing to openly reject the requirements of them and not having the proper documentation, then additional steps will have to be taken.
One of the comments I would have as an add-on to that, I say this all the time in my job, it's hard to fix what you don't know about. Mm-hmm. And when you're a leader, I assure you that's true. And excuse me again. So Mayor invited you to let her know, or let the city know, if those kinds of things are particularly bothersome to you and the rules aren't being followed. I think there's an open invitation to let someone know and expect that we'll follow up. So thank you for sharing that question and that concern. It's legit for sure.
And my email is even easier to remember, mayor@finleyohio.com. So certainly feel free to reach out to me and I'll make sure it gets to the right
Even
folks.
I can remember that one.
I know, right? That makes it easier.
Tammy, we got anything coming in?
We have a question about a person that's having an inpatient surgery or will be staying in inpatient for a few days. What are the current protocols in place mandating a patient's guests cannot return after leaving the patient's room? How would you suggest they go to the cafeteria and get food?
We can talk about that later.
Can we hold on to that one?
Sure. Yep.
Well, let's
I
get
don't know
that
the
one
answer to that.
when Dr. Kose is here.
Okay.
I'm not sure how I would answer that, but it looks to me like he thinks he knows what the answer is, so that'd be great. Elliot from Arlington is asking, how do you feel that Finley and Bvhs has handled the COVID-19 situation so far?
You know what? I think that we have done a wonderful job. And I know, pat myself on the back, but no, it's really been a great community effort. And I think we've really found a good balance between making sure we're appropriately prepared and taking it seriously, but not overreacting. I think we've done a good job of really trying to find that balance to work with folks and not say, hey, everybody freak out, let's sound the alarms, but making sure that we're appropriately responding and preparing.
And I'd add to that, Elliot, not knowing who you are and where you come from, the amount of hours that were spent sort of behind the scenes, if you will, with representatives from the city, representatives from public health, from Blanchard Valley and others to try and figure out what's the best way to manage this situation in the community. I agree with the mayor. And I think the test is the results. You don't have to go very far from here to find incidence rates that are multiples higher than us. And by the way, that's either north and south. So I don't think any of us would say we did it perfectly, but there was an awful lot of open exchange. I think of communities where county people don't talk to city people, or there's these bad relationships that preclude actually good discussion from happening. We don't really have that. And certainly in a case like this, lots of people came together and said, all right, let's figure out what the right thing to do here is. Not in Finley, but near here, we had 2 nursing homes that had some pretty serious problems. And I mean, it was all hands on deck. The support to help them get the right PPE, make sure the patients or the residents were being well taken care of, making sure that we had better training, better staffing, all that was really great to watch. So again, nothing's perfect, I suppose, but if you look at our results, they're pretty darn positive. And I think we have every reason to believe they can continue too, because we have the right things in place, using the techniques we know work, and holding ourselves accountable to do that stuff, I think will really serve us well.
Yeah.
Do we have any more questions?
We do, yeah. This one's for the mayor. What
Good.
would you?
I don't want any more.
What do you think will be hurdles for the community as we start to return back to business as normal?
The first thing is just remembering to continue to be vigilant. It's so easy to start to kind of get back into our old rhythms and literally start just doing what we were doing before. And so, continuing just to make sure that you're hyper vigilant and washing your hands. And, when you go home, kind of everybody going through a process to kind of decontaminate and wearing a mask and trying to avoid crowds for a while longer and just kind of continue to follow that guidance is really going to be the best thing. Next is going to be figuring out what are the long-term ramifications, whether it's with revenue or businesses having to adjust. But again, I think we're fortunate in Hancock County that the majority of our businesses were able to continue to operate or start operations kind of in a modified form. So we're going to see some impact, but overall, it's really going to be kind of just finding that new normal.
That's one of the questions I would have asked you, and it's an add-on really to that. Typically, our unemployment rate is amongst the very lowest in Ohio. We do a lot of manufacturing here. Any sense of what that might look like going forward?
Yeah, so throughout the pandemic, I've been working very closely with Job and Family Services and have been receiving a weekly unemployment report, which shows how many new folks filed for unemployment, as well as then how many people were continuing to be on unemployment. So as folks probably saw in April, our unemployment was 17% compared to our typical 3% in February and previous months.
And the country was probably what, 30%?
It was,
close?
it was very high.
Maybe?
Yeah. So, but we have already started trending down. We started trending down in May. So have very quickly gotten back down where before COVID, we had about 30 folks apply for unemployment a week. During COVID, we got up to, at one point, our highest was 5,000 people applied.
Wow.
We are back down to about 300 folks applied. It would have been 2 weeks ago now at this point, the last report that I can remember. So we're trending back down. That's new people applying. So we're seeing most people kind of are going back to work. And then we had, I think, only about 2,000 or 3,000 people still going on unemployment. So I would expect that our May numbers that will come out here soon will look much different.
One of the aspects of this that I'm smiling is, if you can see my face, it is a really interesting challenge to try and explain the economics of Findlay, Ohio to people that have never been here. And in my world, in the healthcare world, some of the dynamics of how Blanchard Valley works are very, very unusual. And it's a result of being in Finley. And trying to tell someone what it's like to have one of the world's biggest businesses like a Marathon in our town, and a Cooper, and a world's biggest dishwashing manufacturing plant, and so it goes, those kinds of things. You look on the map and you say, gee, a town of 50,000 people, there's tons of those in America, and most of them are slowly dying. And then you say, well, yeah, come and visit and see what you think after that, right?
Yeah. Well, excuse me. It's been really neat too. One thing that I think was in the press a couple weeks ago is we saw a couple of our, automobile manufacturing companies shift what they were manufacturing. So for example, Bvhs is a company that typically produces filters for cars. Well, obviously the auto industry was pretty well closed down for a while. And so they didn't have as high of a demand. They also have a plant in the UK, and there they produce the N95, N99s, and a variety of kind of filter systems. And so they were pretty quickly able to start manufacturing those here locally. And so, they have been able to keep their folks employed as well as expand their demand because they adapted. And I think that speaks volumes. That culture of success and that Finley formula, we were able to work with them very quickly to get approval through the state and to adapt and change so that they can continue to keep their folks employed while doing so safely. So I think it's great, and I always love bragging on Finley companies. So.
Well, I do too. And as a non-Finley person, my time here is 20 years. I can only say that it's a remarkable community, and I really am serious when I try and explain it. I end up kind of saying, well, I think you're really just going to have to come here and decide for yourself. But I think you're going to tell me what everyone does, which is, this isn't what I expected. The Hancock Hotel is a great example.
Yeah.
I can't tell you the number of people said, holy mackerel, that'd be a great hotel anywhere in this country. Yep.
Yeah.
And here it is right here. So it's kind of fun.
It is. It's great. And you didn't even say despite it being in Ohio. So thank you.
Forgive me, but she started it. Go green.
Go Bucks.
Well, Mayor, I think our questions are up. Do we have any more? We do. Okay.
Yep, for the mayor. How will Finley ensure that there are safe and efficient measures in place for voting as we enter election season?
Great question.
Yes. So, we're very fortunate that our voting precincts, we're pretty spread out, and we typically don't have large crowds gathering in them. So certainly, as you always have the ability to do, if you are a higher risk or concerned, you can certainly do an absentee ballot or do early voting, again, just limiting that interaction. We're certainly going to follow the state requirements, and the Board of Elections works closely with the Secretary of State to determine, how that needs to be implemented. But I would say anyone who can vote early should vote early. And then, those individuals who are unable to, I would just make sure that they take appropriate precautions in wearing your mask and staying away from people as much as possible. If you are so inclined and really concerned about being more vulnerable, even wear, glasses or goggles, again, protecting areas where the virus could get in, and then washing your hands and not touching your face. That good hygiene is really going to be the key to making sure that you're able to exercise your right to vote and do so safely.
When we would emphasize, please exercise your right to vote.
Yes.
I think that may be the single most remarkable thing about our form of government. We're a representative republic, and we choose the representatives. So taking the time to vote and be thoughtful about that is a wonderful honor. So yeah, vote, please.
Yeah.
Mayor, thanks for being here.
My pleasure.
We do an elbow bump.
Yeah, there you go. Thank you.
We really do appreciate you
Yeah.
coming over and spending some time with us. And if we have any further questions, we'll send them over your way.
By all means, I try to be very accessible. So please feel free to email me
That
or
is a fact.
or
That is the
Facebook.
truth.
It's easier email because then I'm able to track it and share it with people if I need to, but call my office, get on Facebook, Twitter, and I'm there. So appreciate it.
Great. Thank you so much. You're only going to be able to see my waist here for a second. Thanks.
Yeah, thank you.
Oh, look who I found here.
Good evening, Scott.
Dr. Kose is back. We've got some more questions. And well, let's start with the one that we said we'd deal with, because I didn't have a clue what the answer was, and hopefully Bill does.
Sure. That one was pertaining to visitors of patients in the inpatient area not being able to leave patient rooms to go down to the cafeteria. What is our process and procedure for that right now?
Well, what I would say, and we can check on this, we have changed our visitor policy. We originally started, much as all healthcare institutions did, especially hospitals, of not allowing visitors. So we have allowed visitors to come in. We'd like to have one at a time. I think we can accommodate that with nursing. Certainly if you need to go to the restroom, if you need to go to get something to eat, we have several individuals, volunteers that will help to take someone. We would appreciate everyone having a mask on when they come in, or we will supply that. But we're able to take someone down to the cafeteria to get nourishment.
Are there any others that we could deal with here right up front?
Not
No?
yet, no.
Okay.
No.
Well, Jeff from Arlington. Jeff, thanks for taking time to send us a question. When will the nursing homes reopen to visitors in Hancock County? Real quickly, that's a complicated question because there's federal and state regulations that are a part of this. What's really been, I'm going to turn this over to Dr. Kose to talk about this second, but we've seen a huge dichotomy of what's happened in nursing homes relative to coronavirus. If you read the papers, you're going to read all the time that the hotspots are nursing homes in the country. And I believe that's a true statement. It's also true that many nursing homes and other congregate living kind of facilities of elders have been able to avoid coronavirus altogether. So you've got this huge difference, and trying to figure out what's the right thing, the safe thing for people that are tired of being cooped up in their own little space. People want to visit their loved ones. It's a difficult situation. So Bill, what comments would you make?
I would add on to that. If you go back and you look at this 3 short months ago, we had a virus that we didn't know that much about. We knew that it was virulent, and we knew it was contagious. We didn't know how we were going to react as the host or the receiver of the virus because there had not been any exposure. And I think looking back on it commonsensically, that we're going to see different populations. So it was not going to be homogeneous, that everybody that came in contact with the virus was going to get the same symptoms, maybe even get sickness. And as we have seen, as time has gone on, as Scott talked about, we have vulnerable populations, and the nursing homes are vulnerable for a couple of reasons. One, they're elderly, so your immune system may change. But in addition to that, you're also being in a place where you're confined. And so if there is an exposure, it certainly makes it easier for that to be transmitted. And I think from a standpoint of what the governor has looked at, and good science would say, the more we can keep people from being contaminated or being exposed, the better we're going to be. And it's really difficult. I've used my mother as an example. She's in an assisted facility, has been there for about a year, really is in pretty good health. And until last Saturday, hadn't seen anybody in the family for the first 3 months. So what we've had to come to from a standpoint of society is trying to balance the social isolation, the loneliness, all of the things that can occur that way, balance that with what can be done in the nursing homes, or as our mayor pointed out, in any kind of a sheltered home, especially here, the city mission of how we balance that. I think as time goes on, and that's already starting to occur, we're starting to allow visitors, some outside, and I think we'll be able to let people get back together a little bit more, but it's still a concern. We still have asymptomatic people that could be carriers that could bring things in. So not a great answer, but I think we're going to start to expand that and be able, we've got to get people back to more normalcy.
Yeah, and as Dr. Kose just mentioned, these outside visits, I think lower the risk a lot, and that's going to be a starting point. That's starting to happen around the country, and I think we'll just sort of go from there. Thanks for the question. It's a very big question, and it's a huge issue around the country. So we run 2 nursing homes. You may or may not know that. We now are allowing outside visits, and so far they're going very well. We'll watch and see if there's any problems with that, and then proceed cautiously to see what the next steps might be. This next one's interesting. And Bill, I know you're going to be able to talk about this. Sue from Finley asks, and Sue, I appreciate the question. A recent report came from the CDC, Centers for Disease Control, stating that you can't get COVID-19 by touching an infected surface. Is this true?
Let's go back to when I talked about the virus. What we have learned as time has gone on is by far the primary transmission is by respiratory secretion. So from spittle, that can be either propagated by coughing and someone touching, picking that off of a table or anything else. There also are cases we feel that of aerosolization. And without getting too technical, that means that it floats out into the air. Now, from a standpoint, the CDC, Who, the World Health Organization came out a couple of weeks ago that there maybe wasn't as much as what we thought that could be picked up and could be transmitted. We still feel, and it was not a really good study, it was anecdotal, that people can pick this up from being on surfaces. The problem is trying to define, not so much the surface, it depends on whether it's wood, what the ambient temperature is, but basically we still feel that the way the transmission is that it is going to be by a droplet form. So that could be picked off of a table. It could be something that you have on your hands. And going back to what our mayor said, the key things are still the same. So if the virus has to go to somebody, if you social distance, if you wash your hands, good respiratory etiquette. And in addition, we feel, and maybe we'll want to elaborate a little bit about using masks, that masks are protective of other individuals so that the spittle cannot come out of my mouth to somewhere else. So we still do feel, yes, you could pick that up. I think making sure that we sanitize and do those things just make good sense, and they help with the risk.
And I think the CDC sort of walked back from that.
They did. The studies that had come out really, as I said, they were more anecdotal than anything. And the general consensus of infectious disease individuals, public health, as well as the science of this would be certainly that can occur.
So thanks for that question. Mary from Bluffton asks, since the state has allowed elective procedures again, would you say the health system is recovering financially? Yes, absolutely. Without boring you with too many details, at one point our revenue depletion or reduction from what we would call normal was close to 60%. At a time when we were being told, keep your people on staff because you need to plan for a surge that's going to happen. So there was a period of time when financially Blanchard Valley, along with virtually every other hospital in the country, was going through some very difficult times. It's gotten much better. I would say today we're probably 85 to 90% of normal. The question's an obvious one: are we going to get to normal, or what is the new normal? But it's gotten much better. And I can say also, and Bill may want to comment on this, there were a number of patients that didn't get seen that should have been. Their condition got worse. So we're glad to be able to serve people again, I guess is the point. If you walk around here now, or the nursing homes or our Bluffton facility, it's much closer to a normal feel than what we had before.
Yes, and I would say from a standpoint of the clinical side of us being able to open up procedures, elective procedures, there's 2 points. One, Scott made real concern across the country. I don't know how much we have seen it here, although I may have said on our last telecast that individuals have put off coming in for things that may not be procedures. Specifically, in the case here, was heart attacks or people having problems with their heart that they waited too long to come in to be evaluated, to have a stent put in, to have something done. Understandably, we have talking to the community, coming to the emergency room. If there isn't anything, we had no treatment, that it didn't make, that you didn't need to do that. So that's one concern. There's a study out in New York that 30 to 50% reduction in the number of cancer cases were found during the COVID pandemic there, which again, they were having overrun of their healthcare facilities, understandable, but people putting those things off, you obviously want to find cancer, strokes, heart attacks as early as you can of where you take care of them. The second thing I'd say about us open up elective procedures, that it has been very safe. We are screening people. When we come in, we have not found those. And again, commonsensically, the time to get something done when we don't have a problem. So we feel that our processes and procedures here at the surgery center have worked out really well. And as Scott said, we're pretty back to normal. Now, and again, I have to emphasize what our mayor said, is that we've got to be careful about becoming complacent, because this bug is still out there. We are still going to have viral infections, but we have turned it into a normalcy kind of plan of how we're going to triage and while we look at people. But right now, we feel it's really safe if you're going to have something done.
So Bill, I got a question for you. Is commonsensically really a word?
It is from Ohio State. I don't know whether it is in Michigan or not.
Okay,
Well,
Mayor. Karen from Cloverdale is asking us, when do you suspect there will be a vaccine available in the U.S.?
I'd have to say that it's probably is going to be sometime next year. Now, this is really, it's a detailed, really good question. And I've learned a lot as I've done reading about how do you develop a vaccine. There's at least 18 different ways that this is being looked at. Using messenger RNA seems to be the one that most people are talking about. Virus is just a small particle, and that one would make sense to me. There is being more not only effort and time and money, but resources of the smartest people in the world to get this done for obvious reasons, clinical, financial, et cetera. But to do a vaccine, and I just read that a company in Germany is starting today, first thing is you got to make sure it's safe. You don't want to give somebody something that they end up with a virus and we can't treat it. And then you've got to go out and do a cohort to make sure that they get along. And then you want to get enough people in the third part of the trial to be able to demonstrate that it is effective. So long answer, I think it's going to be in 2021 before we have anything that everyone's going to feel comfortable.
Are you pretty
about.
confident that this virus will be susceptible to a vaccine?
That's a really good question. It's coronavirus. We don't have a vaccine for the common cold. Certainly,
And that's a cousin virus,
it's
right?
a cousin virus that came out. Individuals are concerned if we do find a vaccine, will it be effective for very long? Most of us would say, you get a cold, you get your antibody titers up, and you're good for about 6 months, and then you get another cold. Will it mutate? What will the strains be? But I think the individuals that are working on this feel that we will have a vaccine that's effective, and they're a lot smarter than I am.
I'm not sure that's true, but we'll move on to the next question. Martha from Fostoria asks us, if everyone wears a mask, are we all safer, and can the economy open up more safely? This is actually multiple questions. Good job sneaking in extra questions, Martha. Does wearing a mask put my health at risk if I do not have any breathing issues? And then finally, will wearing a face shield help?
Well, face shield would be similar. I'll answer that question first. A face shield would be similar to wearing a mask. If someone is more comfortable with one or the other, it's just easier, I think, to carry a mask around and to keep it clean. From a standpoint of why we wear masks, well, let me go back. The original reason that masks were not recommended was because at the beginning of the pandemic, there wasn't enough protective devices. We didn't have enough masks. And so they were being asked to reserve. We were being asked to keep those for healthcare workers, those on the front line. That would be EMS, public health, or whoever would be looking at this. As we've developed more masks, that the availability is not as big of a deal. From a standpoint of me wearing a mask when I'm out in public, I am protecting you. This is not, it probably helps you from a standpoint of giving it to me, and so I'm protected a little bit, but the primary purpose is to protect everyone else. And I think it's somewhat symbolic also that we are trying to help take care of each other. What that's doing is catching those big droplets that I would be coming out of my mouth, sputum, etc. So from a standpoint of the question being asked, is it harming you? No, some people cannot tolerate it. I don't know there's any of us that really like wearing that. It's difficult to tell if somebody's smiling or frowning, if nothing else. But that's
why we're around you all the time.
That's true. I can't tell how happy people are. Part of it is also, though, from a standpoint, if you need to keep it clean so that you could get another infection. There's other bugs that are out there. You need to wash it, and it should be done daily so that's not occurring. There are individuals, though, that have respiratory problems, chronic obstructive pulmonary disease, that it may affect them, bother their oxygen a little bit. Most of those people, though, are already used to wearing masks because they don't want to catch things. So the first part of the question is, yes, I think society is safer with us wearing masks for all of the reasons that I've talked about, in addition to trying to reduce, obviously, the propagation of the virus.
Thank you for that question. Eva, not sure how you pronounce that. Apologize if I got it wrong. From Ottawa is asking that she's heard about a new antibody testing for COVID-19. What is antibody testing? And is it the same as testing to diagnose COVID-19? Really interesting question. It's a great opportunity to clarify that.
So let's talk a little bit about testing. Again, we go back 3 months ago. One of our problems that we had was we didn't know much about this virus, and we didn't have any test to be able to tell whether somebody had the virus. Made it a little bit difficult to make a diagnosis. So there's two different types of tests that we can do. We'll talk about the first one is the antigen test, which is, do you have the infection? And so that would be if I had the symptoms that we're talking about now with COVID, a temperature, muscle aching, dry cough, may have lost my sense of smell, of taste. There are things that go along that would make us think about someone having the coronavirus, is that we can do a swab, and then we can take that and we can, with chemicals, look to see if the virus is present. And that's called an antigen test. That
So
tells
antigen is,
the antigen is the virus.
but when you currently have it.
Yeah, and I'm looking at the virus, and this is what's going on. I have the disease. Now, it's a little bit more complicated than that, because
Well, let's keep it simple. I wanna
individuals
understand what you're saying.
may carry dead virus and it may be positive, but in general, that test has become very sensitive. When we get it, you have it, and it's also fairly specific, so it is not missing cases.
Okay.
So that's one. So now I've got the disease and I know I have it. I'm actively either contagious or having symptoms. Then the other test is an antibody test. And this is a blood test that measures, did I develop in my body antibodies, which are the way I fight infection. Our body produces those, and I can go in and measure the levels of those to see if I have been infected. And we're learning a lot about that too. Not everybody gets the same antibody response, but in general, the question is, if you've had the infection and you find the antibody, that confirms a diagnosis that you have been exposed and infected with coronavirus. The problem we don't know is how much antibody do you need for relapse, and also how long is that antibody going to be effective?
So real specifically, no, they're not the same test at all. One's a swab, that's antigen. The other is a blood test, that's antibody. And that's as far as I can take you clinically.
And that's all you need to know. I do want to say something about that, because our mayor asked if she gets questions. One of the questions that has come up really frequently is that individuals need an antibody test to go back to work. I don't know where that's going to be. I'll look over, but the EEOC today came out and said that could not be their recommendation. I don't know if that's federal law now, that is not a recommendation, that you cannot make someone get that antibody test to be able to go back to work. I don't know where that's going to pan out. It really never made an awful lot of sense, although I understood where businesses could be. So that might be something, if it comes up, if you talk to your employer, we'll try to get a little more clarification.
Kim from Cary is asking, how do I get an antibody test?
It needs to be prescribed or ordered by your physician. So talk to your family doctor, could write a prescription. We can do the test here at Bvhs.
Okay. Susan from Finley asks, I understand that antibody testing is not 100% reliable. However, as tests are confirmed, why are those numbers not being counted as confirmed cases?
What we do here, we would say those are confirmed cases. When we would turn those into public health, those would be the test from our standpoint that would be positive. I think part of the question is there have been a lot of these antibody tests that have been out on the market and have found to be not very sensitive or very specific. In fact, I read today that the I don't know if it's the FDA is removing 28 of those that they would say were appropriate. And part of that, it's not that anybody has done anything fraudulently or didn't think that they had a good test. It's just that as we learn more about the specificity specifically about this and the amount of antibody that's needed, that not all of those tests were that sensitive to pick up the amount of antibody.
Makes sense. How are we doing question-wise?
Good. We were able to answer one about, do you need an appointment to get an antibody test? And we answered that one through Facebook. But
Okay.
the other one is a really good question about how should one's actions change if they do have antibodies, since there's still very little known?
That's a great question.
That is a really good question. My personal is I would not change anything. I would still be, now I'm fairly risk averse kind of person. And so because I had been exposed and I was positive, I still would wear a mask. I still would social distance. Not that I think that I could get it. The science would say probably not, but if nothing else, for the example for everyone else, and I'm not just talking about me now or being a doctor, I would treat this as better part of valor, less risk, is just treat as if you had not had it before.
And it is back to a point Dr. Kose has made a couple times. We really don't know how much antibody you need to not get it again, and we don't know how long they last quite yet. So I think it would be risky behavior to assume you could just ignore all the rules.
Yeah, just as an example, if you go out and at least this is an example we used to use. If you go out to a school and you swab every child for strep throat, one or two of them are going to be positive and they have absolutely no symptoms at all. So they may have antibodies that the streptococcus is not infecting them, but they can still be a carrier. So I could have been infected and I've gotten over it, but the virus could be just kind of living there and going. So why expose somebody else?
Yeah, for sure. David from Finley asks us, how many antibody tests have been performed by the lab at Bvhs and what percentage have come back reactive? So as of this week, we have performed something in excess of 700 antibody tests and 22 have come back as reactive. So again, I think another indicator that our area continues to be quite low in its rate of prevalence. And back to what the mayor said, social distancing, wash your hands, wear a mask, be smart about this stuff commonsensically. And I think it's going to help us all.
And it's really good that we have done all those.
When I said commonsensically. Jeez.
I think it's a word. I don't know. I'm going to have to go look that up. Remember, when we've talked about herd immunity, it is really nice that we don't see that much, but still the theory, the science, until we get to 60% of people that have those antibodies or we have a vaccine, we still are really susceptible to there being the potential of a surge or a wave. So vigilance is really important.
Great point. Thank you. Chuck from Finley says, I did not have symptoms. However, I did test as reactive for antibodies. Can I donate my plasma to be used for treatment? And if so, where can I donate locally?
Again, really good question. Through our American Red Cross, we have been working with Mayo Clinic, part of our relationship with them, that we can come up with a plan to be able to use the antibodies. The theory behind this would be you have been infected, you have antibodies, that we could transfuse that into someone that's fairly sick that would need the antibodies to recover. So we can help you if someone has that. You can email me, call here at the hospital. We'll get you in contact with that. It's being taken care of by our local Red Cross, as I said, out of Toledo.
Michael from Finley asks, another person who's tested as reactive for antibodies, does this mean I have a level of immunity against the virus? Should I still be taking precautions? I feel like we've answered that, but probably can't hurt to say it again. I know people wish there were definitive black and white answers to some of these questions. We can tell you definitively there is not in this case. So should you still be taking precautions? Without question. Bill, I don't know if you have any comment.
Completely agree.
Grace from Blust. Love that name, Grace. That's one of my favorites. So we'll try and give you a good answer here. I'm scared to go to the doctor. Are telehealth visits still available at Bvhs?
Yes, we still are doing telehealth. Physicians and our other nurse practitioners are seeing more and more individuals in the offices, but those arrangements can be made at any of our practices. And likewise, the private practices, BVMA, Finley Family Practice, our other Finley practitioners are continuing to do telehealth. This will be interesting how this evolves. I'm obviously getting older, old school. It's really difficult for me to see how I can truly examine someone, but it has worked out. I think we're going to see it more and continuing in the future for chronic diseases. One of the things that I smile when I say this, the doctors are on time on these. That's I think that's a real benefit. If you have a 10 appointment, you're going to be able to get seen. And I think certainly from the mental health aspect, it's now becoming more accepted that people are using telehealth.
Back to Dr. Kose's point, telehealth is obviously being used and it's been effective. But I also would say to you, a physical examination by a physician is still a good idea. That's still the basis of providing healthcare. I appreciate your fear about going to see the doctor, but before you decide you're not gonna, I might suggest you call the office and express your concern and ask them, what are you doing so that I can feel more comfortable, so that I feel like I can safely come see my doctor? I think you're going to find that there's some pretty specific and pretty disciplined approaches being taken. I visited a doctor the other day. I had my temperature taken before I got in the front door. I had to have a mask on before I went in the front door. No one shook my hand. There were a number of things they did, wiped off some material, asked me if I was comfortable by what they were doing, if I had any other procedures, safety procedures they felt they should do to make me comfortable. That's available right here. So I appreciate the fear, but again, it might be worth checking to see if an in-person visit might not be possible to make you comfortable.
That's a really good point, Scott. Having been involved and watched processes, that it really is has been well thought out. It's been consistent standard work of what individuals are doing. And now as a doctor, it's a different kind of relationship trying to do that over the airways. Not that it hasn't worked, but if I were, again, I'm risk adverse, but if I were weighing this, being able to be seen by someone that can really listen to you, touch you, feel something, I think is certainly more important than the potential risk of COVID, especially where we are right now with not seeing that many cases. It's a really good point.
Tammy, we got any final questions?
We do. Just a quick clarifying question. When the newspaper reports the total number of hospitalizations for COVID, is that since the beginning of this starting, or is that currently hospitalized patients?
I believe that they report since we started as to what's going on, and we keep two different numbers. One is that somebody that's a potential, and in addition to what are positive. And so when the numbers that I've seen in the paper are cumulative.
Well, we're coming to the end of our hour. As we close, I want to thank you again, Mayor, for being here with us. Excuse me. Really do appreciate you taking time and being willing to join us. Bill, as always, thank you. Couple thoughts I want to leave you with as we close. First is, and Dr. Kose made this point 15 minutes ago, this is a safe place to come. We have spent many, many hours trying to ensure that we're here for healthcare. We're here to take care of you. We want you to feel comfortable. We want you to feel safe. And we want you to know that the results, the actual data would support what I'm telling you. Our incidence, our prevalence in the area, if we said multiple times here, is very low. So we're ready to serve in any way you need us, and we want you to feel confident. Second thing is a huge shout out to the associates of Blanchard Valley Health System, the physicians, the PAs, the nurse practitioners. This has been a trying time. It's been a very, very different world for many people that provide healthcare services. And again, we haven't been perfect, but our team has worked extremely hard to try and accommodate the regulations, trying to accommodate the needs of the patients. And I'm really proud that they let me continue to be a part of this group, because together they've done an absolutely terrific job. Finally, give us feedback. This is, I don't know, the 4th or 5th of these we've done. We're happy to continue doing them if they're of value to you. If you have some other idea, share it with us. But we'll be sending out a little survey. The results, the number of you that have filled out the survey has steadily been going down. And I suppose that's normal, but we really would appreciate the feedback. And we will adjust or we'll quit, whatever makes sense. So as we close, thank you again for spending time with us. We hope it was useful. Take care and have a good evening.